Good morning, everyone. My name is Dr. Nitin Sethi. I'm the chairman of neurosciences at PSI Hospital in New Delhi. I also work in New York Presbyterian Hospital, Cornell in New York City. Today, we're going to talk about dementias. So when you talk about dementias, broadly speaking, these are neurodegenerative disorders. That means once they start off, they slowly but surely progress. And one thing which patients and caregivers need to understand is there are many different types of dementias. So the most common dementia worldwide, which people must have heard about, is called Alzheimer's disease. It's called Alzheimer's disease because it's named after Professor Alzheimer. It's probably the most common dementia worldwide. And this disease usually starts off in the later age group. So in the late 60s, 70s, patients will start having problems with memory. And initially, it's the short-term memory which goes first. So things like what you did in the morning, what did you eat? People are forgetting things, forgetting names, forgetting where they put their stuff. They start having memory problems. And it's important to remember that patients themselves are not aware that they are having difficulties. It's usually the caregivers, the family, son, daughter, husband, wife, which notices that and brings it to the attention of the healthcare provider. Now, if you or your loved one, somebody is having disorders of memory, you're concerned that they may have dementia, my advice will be to see a neurologist. Nowadays, usually with a good neurological history examination, the neurologist is able to determine whether you are dealing with a neurodegenerative disorder like dementia, what is the likely dementia, whether it's Alzheimer's, could it be something else like vascular dementia. When people have many strokes in the brain, they can start having memory problems. There are tests like MRI of the brain which can be done, and usually what the MRI does is if you do a good MRI, you can look at the brain and see if there's any atrophy of the brain. Is the brain shrinking a little bit, especially the temporal lobes, the hippocampus where the memory is. Other tests like EEG where you can look at the brain waves. There are further other tests like PET scans of the brain which look at the metabolism of the brain. So there are many non-invasive ways where you can kind of pinpoint what problem it is. And I think that's the first step. You need to pinpoint if the patient is having dementia and kind of narrow down what kind of dementia does the patient have. The treatment then follows. So again, if you, your loved one, anybody you feel is concerning, history is concerning for dementia, do see a neurologist. Rightly simple tests will help to identify the disorder. And the good news is that there are now treatments coming out for Alzheimer's disease. Newer drugs have been approved, which may at times reverse the disease process to some extent. There are medicines which can slow down the disease process. Plus, there's a role of supplements, which are called nootropics, how to keep your brain healthy, keep your brain cognitively active, physically active. So there are many ways you can actually help these patients with dementia to either slow down the disease process, arrest the disease process, and now, as I'm saying, some new drugs which can potentially reverse the disease process. Thank you.